Awesome. All right, so thank you everyone, teachers and friends and everyone for being here. My name is Julia, and I've been practicing yoga for over 10 years. I've been teaching yoga and holistic practices for a little over 7 years. I hold the bachelor's degree in health science with a minor focus in business administration. I am an experienced registered yoga teacher under my 200-hour training, and I just received my 300-hour training with Om Hom Shala. And I'm also a yoga therapy candidate with Om Hom Shala. And so a quick note before we begin is that I'm super excited to share this presentation. It is my research, my recent research. So it's not the sum of the field of yoga therapy for scoliosis, right? There's many clinicians and researchers and teachers that have made vital contributions to this field that I may not fully represent here. So I want to open it at the end in questions for your insights, references, lived experiences. So I hope this presentation sparks constructive dialogue for us that we can all learn from. So our journey through yoga today is a holistic approach to improve posture and alignment in idiopathic scoliosis. So millions of people in the world are affected by scoliosis, and many people are searching for alternatives, right? We want non-invasive, empowering alternatives, and yoga therapy is that approach. I do not personally have scoliosis, but my younger sister does, and she was my inspiration for doing this research. So what is scoliosis? It is an abnormal side-to-side curvature, so a lateral deviation, and it usually forms an S or a C curve. It is three-dimensional. Scoliosis is three-dimensional, right? The curve can include lateral deviation as well as rotation of the spine. And this can produce visible asymmetry in the shoulders, in the ribs, in the hips. And so what causes this? So most cases of scoliosis are idiopathic, meaning it's an unknown cause. Some curves remain stable while others can progress over time. Current treatments involved with scoliosis, we're looking at Western treatments, allopathic medicine. Western and allopathic medicine are synonymous. So monitoring is a big treatment, right? Because we're watching the curve. That means regular clinical checkups, regular x-rays, just to watch the progression or, hopefully watch the non-progression of the curve in mild cases. When we talk about bracing, we're looking at, it's typically used for growing children to prevent the curve from progressing and to just give stability to the spine. But it can also be used for adults to also provide spinal stability and improve posture. The downside is that braces can be expensive, they can be uncomfortable, they can cause skin irritation. And then looking at spinal fusion, that's a surgery. And that's considered for the larger curves, more progressive curves, and it can correct and stabilize the spine. However, there's complications that can arise from surgery, of course, such as nerve damage, hardware problems that might require additional surgeries, and general surgical risks that come with any major surgery. And so that's why we want to look at yoga therapy as a solution. It addresses asymmetry. Targeted therapeutic movement practices and strengthening can reduce muscle imbalance, right? And this improves functional symmetry. And there's clinical reports that we'll look into that suggest that measurable postural changes can be achieved with individualized therapy. Yoga therapy supports posture, right? We're working with somatic awareness. We're working with alignment cues and core stabilizing practices. And this can all help improve upright posture and movement patterns. And yoga therapy also improves breath mechanics, right? Breathing practices, thoracic mobility. This can work to increase chest wall expansion and may reduce those restrictive effects of those thoracic curves. And then, of course, overall I didn't like how that was at the bottom, sorry. Overall, yoga therapy is great for mental health. We're working with mindfulness, body awareness, breath awareness, and breath regulation. And this can help reduce anxiety, improve coping, and support overall quality of life. So we want to focus on the symptoms. What is our primary symptom focus? Postural imbalance, right? Because over time, the body compensates with uneven muscle recruitment. If we're looking at a C curve, muscles on the convex side of the curve can become lengthened and weaken over time, while the concave side of the curve, those muscles can become shortened and overwork, right? This can result in pain. It can result in reduced range of motion, altered movement patterns, right? Breathing is considered a movement pattern that we can train with yoga therapy. Deeper breaths. All these symptoms can impact our overall well-being, our overall emotional health. So how does yoga therapy help these symptoms? Because yoga therapists can provide these individualized protocol progressions, we're going to build functional movement over time, promote foundational core support that protects the spine, as well as reinforce spinal support in other ways. So looking at an overall protocol, what does an individual with scoliosis need? It's very important for us to work with isometrics. That means short, held contractions that will build this segmental stability in the transverse abdominis, which is our deep core engagement, in the pelvic floor, and in the diaphragm. And all of this helps to scaffold the spine during everyday tasks. And then, of course, we're working with breath and meditation. This helps calm the nervous system, lower pain-related stress, and improve breathing to support better function overall. So looking at our comprehensive review, I wanted to take a dive into a protocol that I created with my little sister in mind. She is 24, so this is individualized to her. How does that look for you guys? I feel like it's pretty good. We're not going to go through every single posture here. Overall, we just want to emphasize when we're working with a protocol for scoliosis that we're just exploring yoga, right? We're not fixing anything. It's an exploration. So I'm just kind of going to go through it kind of quickly. There's one posture that I do want to focus on mainly. The cactus arms, the shoulder work. This is going to help with chest wall expansion, right? Cat-cow, mobilize the spine. And a lot of these are just typical hatha yoga poses. Notice how there's not a lot of deep back bending, not a lot of, no deep back bending, no deep twists, no deep side bends, right? Most importantly, we want to look at working with gravity when we have scoliosis. So a dead hang exercise is a great option. Offering this to, have a secure pull-up bar. Like, we want to make sure that we're safe when we're doing a dead hang exercise, but of course an inversion table does the same thing, working with gravity to elongate the spine, to decompress the spine, increase flexibility, and strengthen the core. And then this protocol finishes out with just some nice restorative stuff, because we always want to work with meditation and mindfulness and allow ourselves to finish the protocol in a nice, calm, relaxed state of being. Let's go back here. Great. So I want to invite us to explore some yoga. So remember that this is all optional. You don't have to participate in this. The breath work is a really nice breath work, just a simple 3-part diaphragmatic breath. So I'm going to let Larissa teach us Dirga Pranayama. And then after, I will share with us the asana experiential portion. And then the asana portion, I just want to reiterate that it is all optional. You can just watch and enjoy as well. Let's watch Larissa explain diaphragmatic breath. Can you hear it?
In the Kornbluh tradition. Watch for a moment while I fill the whole torso with breath, starting first with the belly, expanding my breath into the rib cage, and then filling the upper chest and collarbones with breath. Then we'll do it together afterwards. Okay, now it's your turn. Sit up nice and tall, rest the hands on the lap. Allow the eyes to close. Send the breath down into the belly. Imagine filling a balloon. Let the belly expand and open with breath. On the exhale, deflate the balloon of the belly, gently squeezing empty. Inhale down into the belly, let it open and widen with breath. On the exhale, draw the belly button back towards the spine, squeezing out the stale air. One more deep abdominal breath like that, smooth and steady. Good, and now building into the full 3-part breath. Inhale down into the belly, let it balloon. Take in more breath, flare open the rib cage. Sip in a little bit more breath, fill the upper chest and collarbones. Stay tall for the exhalation, squeezing out. And start again, fill up first the belly. Take in more breath, flare open the rib cage. Sip in a little bit more breath to the upper chest and shoulders. Stay long, exhale fully, squeezing out. And again, fill up first the belly. Flare the breath into the rib cage. Flood the shoulders with aliveness. Stay tall for the exhalation. And one last round, smooth and deep. Belly, rib cage, collarbones. After this next exhalation, return the breath back to normal. And keeping the eyes closed, scan the entire body and feel the imprint, the afterglow of the 3-part breath. Notice what has been expanded, purified, softened through the breath. Draw the hands together in front of the heart and gradually let the eyes open. Jai Bhagwan.
Thank you, Larissa. So we want to move into an optional asana experiential, right? So using that 3-part breath, even just sitting still here, you can feel the difference already, how you might feel a little bit more open in the chest and in just the whole thoracic region. So using that in combination, in conjunction with our asana, that's how we're going to really open up and expand. So thinking about how we can breathe into those concave spaces if we're looking at scoliosis, but even if you don't have scoliosis, that 3-part breath is a really powerful yogic tool, right? So before we jump up and do some asana, I just want to invite, if you are partaking in this experiential, that we first just do some seated cat-cow, right? We plant the hands on the thighs. We want the feet nice and flat on the floor. Maybe spread through the toes and really ground through the soles of your feet for a moment. Kind of sit up nice and tall, like there's a little string on the crown of your head pulling you up. Notice your breath. And then work with a little bit of seated cat-cow to mobilize the spine. So thinking about if we have scoliosis and we're working with some seated cat-cow, I kind of want to scoot back here and just give you a little bit of a idea of what that looks like. See if I can show you a little bit more. So seated cat-cow, we exhale to round and curl, little bits of movement. Because if we have the scoliosis, we're not doing deep extension or deep flexion. So extend as you inhale, looking up a little bit, lifting the chest a little bit. Exhaling to round and curl. Notice the movement in the spine, how that feels in your body. Couple seated cat-cow. Okay. And then after we mobilize the spine with seated cat-cow, I want us to keep the spine straight and invite in a little bit of hip circles. So we keep the spine nice and straight, but it's coming from the hip region where we just start to circle and invite some movement and start to mobilize. Nice breath. We're connecting with three-part breath. And then taking it in the other direction. Slow and mindful. Keeping that awareness as if there's a little string at the crown of the head pulling you up, so long spine. And after some nice hip circles, explore this as long as you like. I want to start to demonstrate what it would look like to take our chair plank pose. So I'm going to jump up out of my chair and push it back as much as you guys can see. And just a quick side note, I know you might be able to tell that my chair is a rotating chair. So you want to be really careful if you have this at home. You don't want any moving chair parts. Have a very stable chair whenever you do chair yoga, right? But just for our purposes today, I'm going to show you on this kind of swivel chair. So we want to be about hips to shoulder distance apart from the chair, and then plant the hands on the chair, right? So we start in essentially a chair tabletop. So get that comfortable chair tabletop and spread through your fingers, connect through the fingers and the palms of the hands. And then slowly we'll step the feet back a couple feet until you feel that you have a comfortable angle here. Not too far, but so much that you can keep a long straight spine and it feels like you're in a plank pose. I know you feel that work if you're practicing with me right now, right? And then to move into a side plank pose, really simple. We want to think about how our feet are going to land. We're going to come to the outside edge of one foot and the inside edge of the other. So depending on which side you go to, either one, you'll be heel to toe, getting the feet comfortable, and then reaching that arm up. So if you have the right foot in front of you, it's most like your right arm is reaching up, and that's our side plank. So fire up in through the side body muscles. Notice how that feels. On the side that's really working, and on the side that's the difference between the side that's reaching up and opening. And then we'll just come back to center. Feel that side plank. I know it's building some heat for you because it is for me. And then we'll take that side plank on the other side. So just dropping the heels to the other side, we end up toe to heel, and the other arm reaches up. Breathe into it. Take a nice breath, especially into those nice working muscles in the side body. And we'll bring it back to plank pose. Walk the feet up nice and slow. And then rise up nice and slow. Maybe a big inhale to reach the arms up. And we'll bring hands to heart center. And I'm going to meet you back here at the desk. Beautiful. So if you join me for the experiential, thank you for participating. It's really good just to take little movement breaks throughout the day. Not only if you have scoliosis, but for everybody. It's important for us to move because movement is medicine, right? We create synovial fluid flow to the joints. We lubricate the joints when we move. So just little things throughout the day. And we're going to move on into the research, right? Evidence. So research and clinical practices show that therapeutic yoga is more than just stretching, as we just felt in the body, right? A lot of strength, a lot of muscle, heat can be built. And it's this nice multimodal intervention. It's more than just stretching. It is strength, it is breath, it is sensory motor control, and somatic awareness. And all of this is going to support pain reduction and functional gains. And so our first piece of evidence that I want to share is with Dr. Lauren Fishman. So Dr. Lauren Fishman's study, side plank study, reported measurable reductions in scoliotic curve. So this was a clinical study that showed reductions in the curve angle with a targeted daily side plank practice. And this was over a few months. I think it was over 6.8 months. So that suggests that there's specific yoga postures that can actually produce structural change in some cases. And then I looked into the Schroth method. So the Schroth method, it's an individualized exercise plan and breathing-based approach. And this targets derotation of the spine, elongation of the spine, and overall muscular symmetry to improve posture and manage scoliosis. This aligns with yoga therapy because imagine including knowing how to breathe, knowing yourself a little bit better, body awareness, proprioceptive awareness. That's going to help us in every aspect of life, and then bringing it into these alternative methods. Schroth method is aligned with physical therapy. A lot of physical therapists will recommend Schroth method. And then just looking at like general yoga therapy research, there's always more research being done, increasing evidence showing yoga can reduce pain, improve balance, enhance posture, and increase body awareness. And then overall, that contributes to just better quality of life, better function across all populations. So in this slide, we're going to look into what is the Schroth method, right? Dr. Dave Butler, I have a video here. It's a little bit of a longer video, so stick with me. I'm going to skip a little bit through it. But Dr. Dave Butler with Align Therapy is going to explain the Schroth method, the corrections, and just demonstrate on an actual patient. And so we'll get to see how this works and how this looks. Right, so let's see here.
Hi, so you can see how this works. So what we're going to do first, we identify where the curve is. So on Kelsey, we have a curve that goes to the right. So it goes to the right in the thoracic, and you can tell that because this shoulder blade sits back further than this shoulder. Hi, David. What we're going to do first, we identify where the curve is. So on Kelsey, we have a curve that goes to the right. So it goes to the right in the thoracic, and you can tell that because this shoulder blade sits back further than this shoulder blade. Sometimes it's hard to see on a video because you're not seeing in 3 dimensions. She also has a curve that's lower in the back to the left, and if she relaxes a little bit more, yeah, there we go. She shifts to the right with her trunk, and her pelvis shifts to the left. The reason for that is this is her main curve up here up top. And if gravity takes over and she's not actively correcting that, then this concavity on the left side is going to collapse a little bit more, and we're going to see this shoulder go down. We're going to see her shift to the side. So that's Kelsey's curve. So what we're going to do now is we're going to use the Schroth method to activate different muscles and breathing patterns to reduce the imbalance that we see. So the Schroth method is designed to treat all 3 dimensions of scoliosis. What I mean by that is one dimension of scoliosis, we have a C or an S in the spine. So that's one plane that we see. The other aspect of scoliosis, the other dimension, is the rotation.
I'm so sorry. I thought you were able to hear it.
I could hear it just fine.
Yeah.
Okay.
I can hear it as well.
Oh, okay, great. All right, I'm just going to let it play. I'm sorry it's not working for you, Melinda.
So in Kelsey's spine, you can see that she rotates back like this on the right side and forward on the left side. So we have a rotation associated with that. Then if we looked at her from the side, we don't have to change the camera view, but from the side, if we look at her back, it's fairly straight, like straight up and down. Normally we have a curve in the upper back that goes out this way and a curve in the low back that goes this way. In Kelsey's back and most of those with scoliosis, we see a straightening of the kyphosis in the upper back. So all those 3 dimensions we want to work on with the Schroth method. So we use breathing techniques and muscle activation. So let's go through this just a little bit and see what progression we're able to see with Schroth exercises. So first thing, Kelsey, that we do is we sit tall, which you're already sitting tall. Kelsey has good posture already.
Thank you.
So that's half the battle right there. Then we are going to correct her pelvis. So naturally she wants to go this way. So we're going to correct her pelvis where her trunk is centered over her pelvis. So that looks really good. She's centered over the pelvis and she's sitting up nice and tall. So that's part of correcting the base. We want to start at the base because that's where we can build off of. Just like you're building a tower with building blocks, we want to start with the bottom block. If that bottom block is tipped, then the whole tower is going to be tipped. So we don't want that to happen. No leaning Tower of Pisa or anything like that. Not that you're leaning Tower of Pisa. But so we've corrected the pelvis. We're sitting tall. So now put your hands up on this bar, Kelsey. And she's going to take her elbows and push out. That helps to open the ribs up. And then I want her to take some deep breaths. And each breath, we're trying to feel expansion through the ribs. So that expansion, we can see right now that she's expanding on the left and the right and everywhere. We're trying to elongate the spine. We're opening things up by elongating upward. But we have to keep in mind that this part of her spine is straight front to back. We don't want this to get too straight. So if she gets too tall and I pull her hair and she gets too tall up here, we start to lose that natural curve that should be there here. So I pull her back a little bit so that we keep that. So now what I want you to do is try and breathe and expand into that concave side. Give me a big breath right there. Good. Can you feel that? That was good. Try to keep that shoulder relaxed, elbows pushing out, and we're going to breathe and expand right there. Good. So we expand outward into the concavity. Some people say you can't breathe into one lung and not another. You're right. We breathe into both sides, but we're allowing expansion on the left side more than on the right side. Very nice. Head tall. So we have one other dimension that we need to work with, and that's the rotation. So we'll breathe in rotation where she breathes back on the left and forward on the right. That is fantastic, Kelsey. It's been a while since we saw Kelsey, and I think there's a little muscle memory going on here. This is good. So backward on the left and forward on the right. So we're getting a derotation in the spine. So every curve is different. Push out here a little more. There. Now breathe again and derotation. Back here a little more. Perfect. So each curve is different. Some have more rotation that we need to correct. Some have less rotation. But really what we're trying to do is the imbalances that we see and the asymmetries that we see, we want to change the breathing patterns and the muscle activation to reduce that, to just unwind the spine, elongate the spine, and bring the curve back towards midline. So hopefully that makes sense. Hopefully it clarifies a little bit what we're doing with the Schroth method. The Schroth method is done in multiple positions. So here we're doing a sitting correction. We do it in standing. We do side lying. We do a bunch of different corrections. You can go and relax, Kelsey. And each position that we do has a different benefit. And so there's a lot of things to the Schroth method. It's been the most researched out there. And that's why we choose it to do for most of our scoliosis patients. So hopefully this helps. We did a part 1 of this video, so you kind of look at that, me explaining with a spine, but now we're explaining with an actual person that has scoliosis, and it's a lot easier to see, and Kelsey does fantastic in getting that derotation and that breathing. So thanks for your help, Kelsey, and thanks for watching, and tune in next time.
Thank you, Dr. Butler. So as you can see, this was a demonstration on a young adult However, the Schroth method works for idiopathic scoliosis in all ages, right? Thinking about combining different therapies, working with everything, right? People who practice yoga, we don't just practice yoga. We also run and walk and swim, and maybe we bike, play tennis, right? So just combining different therapeutic methods is really like the core of yoga therapy, like collaborative work. You know, the sister science of yoga therapy is Ayurveda. So there's so many different approaches that we can use in combination and different, you know, holistic and therapeutic practices. And Schroth method falls under that. I, in my research, saw a lot of people, a lot of young adults and adults in general, they really enjoy the Schroth method and have really seen great improvements with the Schroth method. And it's one of the really highly recommended ones by physical therapists. And so that's why our next slide, we're looking into ethics and integration. So most important thing to remember is that ethical yoga therapy is going to combine everything, right? Individual assessment through yoga therapy and clear collaboration across medical and other rehabilitation teams so that our clients are safe and we maximize functional gains for them. So contraindicated poses to work with scoliosis are our deep twists, our back bends. We don't want to do deep back bends or deep side bends or deep twisting. Also remember when we're working, like let's say we're going to the gym, we're not loading one side of the body with heavy weights because that can also, you know, so why don't we do contraindicated poses is because it can destabilize the spine and just put unnecessary stress on the spine. So as yoga therapists, we want to remember to really be mindful of how this works, right? And work with collaborative care, work with doctors, work with physical therapists, work with occupational therapists and other care teams, right? Because this will ensure safety for our clients and continuity across their medical care. And so to compare yoga therapy and Western medicine in general, yoga therapy is holistic and individualized, and Western medicine or allopathic medicine is more standardized. Overall, yoga therapy and allopathic medicine serve different but complementary roles. And then obviously the safest, most effective care combines both. Ideally, we can use yoga therapy to avoid things like bracing and surgery and just kind of stick with the monitoring side of Western medicine. So regular checkups, regular x-rays, and then just use yogic tools outside of that to keep everything safe. Because as we know, yoga practices are going to build that strength in the body, build that body awareness so that we're supporting ourselves. Even though Western medicine is often the primary intervention, and if you go to a doctor, they're not going to say, oh, do yoga therapy. It's important that we sometimes act as our own, you know, guru and understand that there's a lot of different therapeutic and holistic practices that can help us. And especially those with different chronic things like such as scoliosis. Okay. So to conclude our journey through yoga therapy for scoliosis, overall yoga therapy and Western and allopathic medicine are serving different but complementary roles. And the safest, most effective care combines both of them. Yoga therapy offers measurable and holistic benefits. It supports spinal health, breath regulation, emotional regulation, and encourages long-term self-management and collaboration. Right, which is what I mean about becoming your own guru in a way. You understand your body, you know yourself, and your care becomes a little bit more of self-guided, working with a yoga therapist and a physical therapist, working with a yoga therapist and your occupational therapist. And looking at the future, hopefully we can expand access for yoga therapy for scoliosis, online yoga therapy classes, such as the ones that Om Hom Shala provides for many different chronic illnesses and things, and maybe different local community clinics, just so that more people can receive scoliosis-focused practices without having to wait in a long list or relying on specialists. Ideally, we can have scoliosis-focused yoga classes that will avoid and remind students to avoid deep back bends, avoid deep side bends, and somebody who is specialized in scoliosis that can support students in that journey. We want to be able to keep integrating with allied health. So that just means occupational therapists, physical therapists, and doctors, and continue research and protocol refinement. So hopefully there will be a lot more research, and I know there will be more clinical studies that prove and provide evidence-based research behind yoga therapy for scoliosis and holistic practices for scoliosis, so that we can continue to refine these protocols and what's really going to be super beneficial for somebody with scoliosis. So I want to move into just saying thank you so much for your time and for your attention. And then I kind of wanted to leave some time here for us to have a bit of an open conversation. Please share your questions, your comments, concerns, suggestions, insights, lived experiences. I know I have a lot of amazing teachers, students, friends in this Zoom call. So thank you so much for being here and supporting our journey here through yoga therapy.
Julia, can you send us some the list of exercises that you show?
Yes, I will send out a thank you email to each and every one of you. And in that thank you email, I'll make a note to include that yoga therapy protocol for scoliosis. But just remember that that protocol, I had my sister in mind. She's 24. So there are some challenging postures in there that we just want to be mindful of if you were to take up that practice.
I do what I can.
Yes, exactly. Modify where you need to. You know your body best. Lola, you come to yoga all the time. I'm like, that's the beauty of yoga. It builds body awareness. So it's like you are your own guru. I like to say, gee, you are you.
Exactly, but to get an idea.
Yes.
Okay. Yeah.
Thank you so much.
Julia, you have some questions in the chat. So I don't know if you want to go in or do you want me to read them for you?
I think I can open them and view them while my screen is still open.
Yeah, let me know if you want me to read them because there's some from Christine. But I just wanted to make sure that you got to her question.
Thank you. Okay, let's look at it. So about belly, breathing to the belly. When you have some time, show me
how go higher. No, go higher. There's one more.
Oh, I see that. Okay.
Yeah.
So we're looking at posture, slouching. We want to try and stand with proper posture, but it can be tiring. So what can we do to improve posture? So a big thing in this research that I looked into is yoga is building body awareness. So it's just kind of catching yourself, realizing when you're slouching, and then just sitting up a little taller, right? Allowing yourself to kind of grow tall through the spine. Working with the classes with Om Hom Shala, like keep going to those PD classes with Grizel, with Dawn. Those postures those asanas are going to support posture. And then just remembering that it's that body awareness aspect where it's like, if you find yourself leaning over, that's okay. You noticed, and that's the powerful thing. So you just remind yourself to sit up nice and tall, right? I hope that answers your question. Thank you.
Julia, I'm
Hi,
trying to
Isabel.
send you. I'm sending you a chat. Wait, hold on a second. Let me get out of there. How are you?
I'm
Listen,
so good. Thanks for being here.
I was looking at places because I'm moving and I didn't get all your exercise. I'm sorry I missed out on this. And I talked to Melinda, you're talking about different, like your whole presentation is awake. I can see it so I can catch up on it. And I have lack of proprioception, like, in sensory. And then in the last year, I found out I had a fracture where they didn't tell me, and I have pinched nerves all over from the knees, feet, SI, and it's like, I didn't know. So I'm dealing with all that, and it's like, I don't know how to really start to get that awareness of the body without the body contracting, because the mold is in the mold. But I was just wondering if you had the exercises there, and then you talked about people that there's classes. I'm not aware, I've never had this journey, so I'm not very resourceful on all this. I've always been so active.
I know you are. I will make sure that you get those resources. So I just want to make a note really quick. In my follow-up email, I want to send you guys not only the protocol from today. So I'm just going to make a quick note, protocol from today, and I want to send you information on Grizel's classes. So you'll have the Zoom link in your email so that you can know what time. It's all online. It's all on Zoom. So you can just do it from your living room. It's super accessible. So let me make a note to include Shala classes in reminder or in follow-up email, right?
So
and then
are the Shala classes, some of them, I looked like for chronic, because now they're saying it's a year chronic, but it's like, I don't know what came first, the mold or that. And when I moved, it was the worst thing because I didn't know I had the fracture. So I lost all my muscle from the mold. And then I saw that they work with chronic pain, but do I have to go to Miami or what?
That's the beauty of this online Shala with free yoga therapy. You can do it from your living room. You just sign on. So I'll make sure that that info is included in the email. And then just to touch on your question with posture is breath. I think that I kind of missed out on describing that with Christine's question too, where it's like breath is going to help your posture too. Using that diaphragmatic breath to expand as you sit up nice and tall, that is going to help improve posture, improve spinal alignment over time. It doesn't happen overnight. Rome wasn't built in a day, but if we work with it a little bit every day, maybe like a 5-minute movement break, 5-minute breath, just putting on Larissa's video and then maybe continuing with some diaphragmatic breath for a little bit. It's just those little things. There's a lot of resources with Om Home Shala and then beyond, just, out there on YouTube and different researchers, clinicians. There's some really smart people out there on YouTube. And if you have just specifics, I'll make sure that I can send it to you. You have my number, so text me.
Yeah, because the mold gets your lungs. I mean, it gets your chest, and then I lost all the muscle, and then I moved, so it got you get stiff, and then I stopped the kayaking, so it was like I didn't get the circuit. So then you get the adhesions from so much kayaking, so it's hard for me to breathe. And I just found out through asking for doctors' records that I might have sleep apnea, and I have problems with the nose, the breathing. There's deviations. No one told me this. So it's like, I've been like this a year and I'm finding this all out. So it's like, people say breathe. It's like, you want to cry because you want to breathe. And I just think, just breathe through anyhow you can, through all your cells, Yeah. So any information, any help, anything would be great. I would appreciate it.
I'm here for you. Thank you for being here today.
Thank you.
Thank you. And then I'm looking at a couple more questions in the chat. So about belly, breathing to the belly, thinking about when we're breathing into the belly with the diaphragmatic breath, you want to relax your belly, right? Breathing into the belly means relax your belly space, let it expand. So I always think about it like a baby. If you watch a baby breathing, there's so much movement in the belly, and even their little shoulders are moving, their little fingers and toes are moving. Like breath can be such a full body experience.
Yeah.
Yeah. And so breathing to the belly means just relax your belly, allow yourself to have some relaxation. Maybe you put on some meditation music. Support yourself where you can. If you have a favorite candle, if you have a beeswax candle, if you have some essential oils that really like resonate with you, using those in combination with your breathwork practices might really enhance that practice. Yeah. And I'm gonna look at Kathleen's question here. Insightful. You guys can see this, right? I'm looking at the questions. You can see the questions as well.
No, I just see, please take a moment to provide testimony for Julia.
Yeah,
Okay.
Julia, you might want to read the question out loud. I think that would be helpful.
Okay, I will read this. So thank you so much, Kathleen, for being here, number one. So two, I'm going to share your message with everybody just so we're all on the same page. So Kathleen said, this was insightful. Having been born with mild scoliosis and being encouraged to keep moving, I was reminded through your presentation that my recent neck and shoulder impingement could very well be because of the scoliosis, since I'm not moving as much currently due to a change in workload. That's an important insight. And I thank you for sharing that, because that's the most important thing with scoliosis, is just to keep moving. Stagnancy is what's going to make this pain worse. I was watching a video from Elise Miller where she talked about, she's really on top of her scoliosis work. She's a really big teacher, researcher in the field of yoga therapy for scoliosis. And in the video, she was explaining how there was like an 18-hour plane flight that she was on that really reminded her that stagnancy causes pain. And I know that we can experience, everybody has experienced that. Oh, it's a long plane. I feel so stiff after. It's like thinking about how that can really be enhanced in a body who experiences scoliosis. That stagnancy is like 10 times worse. So just giving yourself movement breaks. Maybe you just do it in bed, rolling, before you roll out of bed in the morning, you give yourself little bits of movement. Maybe you pull your knees to your chest and just kind of tune into what feels good. There's so many different yogic practices and tools that that are available to us. And it's just kind of seeing what feels good for each body. If we're feeling really stiff one morning, maybe we go a little easier on ourselves, but still do that movement, because if we think that we don't need it, there's like a quote. It's like, if you think that you can meditate for 10 minutes, or like if you don't have time to meditate, then maybe you need to meditate for an hour. If you love to meditate, you need 10 minutes. So it's like, oh, if you think that you don't need to move, maybe give yourself a little bit more time and space to move your body how you can.
Julia, you mentioned something about not doing a back bends, and I was at an infrared yoga and a Torah, and they did a lot of back bends, and I was wondering about that. And why would, if you want, they say that we need to get flexibility in our spine to breathe. So don't we want to gradually, like the cat cow, some people say, don't do that till you get your sacrum and your back done. But then it's like, you get stiff. So it's like, what do you do and not do,
Right. Well, it's kind of just seeing how you feel day to day, thinking about, we're not going to the end range. We're just giving ourselves a little bit of movement. We're not really like overstretching, is what I mean by deep back bends, deep side bends, deep twists. It's
Okay.
right. There's little indications from your body that you're pushing too far. Things like tingling sensations, numbness in the body. Those are really indications that we're pushing too far. in any body, not just bodies who experience scoliosis, deep twists, deep side bends, deep back bends. But this is mainly focused for bodies who experience scoliosis. So it's like if you know that you don't have scoliosis, then you can feel more comfortable, right, getting into a deep back bend, but just still being mindful, because there's that level of it can be too much. We can give ourselves too much sometimes. So just to take it easy. Yeah. I'm scrolling down a little bit. Eventually, I will invite everybody to drop a testimonial that is in the chat, so that you'll be able to just provide a little bit of feedback on my presentation today, questions, comments, concerns there. But mainly, like, I wanted to open up enough space and time for us to talk about that in person right now, because we're all together right now. So I have one from Kathleen. Thank you so much, Kathleen. And then I'm moving down to, I have one more from Christine. So if the inhale is short, how to improve the length on the inhale? So what we can do to improve the length on the inhale is work with Ujjayi breath. Ujjayi breath is that it's very similar to the breath work that we practiced today, 3-part breath. It's the same thing. However, there's a little constriction in the throat. So how I teach this in class typically is that when you're exhaling, it's as if you're fogging up a mirror, right? So it's the little, how you're lengthening out your breath with when you're fogging up the mirror, it's lengthening it out. You can use that same constriction of the glottis in an inhale. Through Om Hom Shala, there's a breath work technique that we learned called home breath. Home breath can teach you how to use that constriction on the inhale, because with home breath, we would do home on the inhale and home on the exhale. So just to demonstrate for you really quick, it would sound like, oh, right. And it teaches you, it trains that muscle. You feel you guys are practicing it. I know it sounds a little funny because you're making sound on that inhale. But
are you saying oh, or are you saying home?
Home.
Home.
Home. So you're like home. So it's a home on the inhale, home on the exhale. That can also train the muscle to close off so that you get a longer inhale. That's just kind of something to play with. That practicing Ujjayi breath can be really important with lengthening your inhale and teaching you how to like take a longer inhale. But generally, when we're working with calming the mind, when we're working with tuning into the parasympathetic, yes, we want to have a long inhale, but we also want to focus on a long exhale, because the exhale is how we're really going to tap into the parasympathetic nervous system. And it's how, we thinking of the lungs like a bus. There's a book by James Nestor called Breath. If you think of the lungs like a bus, all of your CO2 passengers need to get off the bus. So you need to exhale all the CO2 in order to bring on more O2 passengers. So to inhale more oxygen, we want to make sure that we're getting that exhale out. Just nice long inhales and long exhales. And then, of course, just keep going to yoga, keep tuning into Om Hom Shala classes. Teachers are always going to share either Durga or Ujjayi. Those are really core traditional diaphragmatic breathwork practices that are core to the yoga practice and traditional yoga and the roots of yoga, right? Yeah. And then looking at one more comment from Kathleen, thank you. So perhaps starting with a teacher who focuses on scoliosis and not a general class at first. Yes, that's a really important little tidbit, especially I would say for somebody with like a deeper curve. Mild curves, like my sister has a pretty mild curve, so she can kind of get away with like going to different yoga classes. She's also 24, so she can just get away with it. But ideally, you want to focus on a teacher who has done this research, who has worked with scoliosis. Yeah. Oh, yeah.
Yeah.
Start with a teacher who focuses on scoliosis. If you have scoliosis, work with somebody who's dealt with it before, who understands scoliosis. Maybe they have it themselves and they've worked through it themselves. That's why in the beginning, I just wanted to say, like, I'm not an expert in this field. Like, my body does not experience scoliosis. So it's not something that I have like a very personal, deep connection to, other than knowing how my sister moves throughout the world and how it impacts her life. Like, for example, like standing for long periods of time. We want to, find somewhere to sit and just relax the body, allow ourselves to relax if we can. Evelyn's, thank you for the information. She said, my friend was told that her scoliosis can be handled with regular yoga classes, that she doesn't need yoga therapy. What would you tell her to let her understand the differences in terms she can understand? Thank you for that question. Okay, so if she thinks that she doesn't need yoga therapy, and that she can just simply go to regular yoga classes, I think that she should understand the implications that going to a regular yoga class, your teacher might invite you to do a deep back bend, to do a deep twist, do a deep side bend, or it's just that they might have those postures in the class and then not really be watching every single person like as closely as we might really want to be. Because, if there's a lot of people in the class, it's kind of hard. But just that you get individualized care. That's really what the core of yoga therapy is, that we're going to look at the individual. It's a very person-centered practice. So we're going to look at their health history. There's a lot of differences on just going to a regular yoga class versus having somebody who's been trained 800 hours in yoga therapy, right? So a lot of value in working with a yoga therapist versus just jumping into yoga classes if you're experiencing pain from scoliosis and things like that. But just regular yoga in general is going to be good. But I think that that's the biggest difference in like understandable terms, that yoga therapy is individualized and regular yoga classes can be just very general. Right. Okay. So let me see if there's any more questions. We have, of course, there's some testimonial links in the chat. If you are ready to drop a testimonial, I'm so grateful if you do. Thank you. So from Christine, thank you again for all the information provided. It's very helpful. And so that is all the questions that I have in the chat right now. So if there's any other things that have come up as we've discussed these questions, please don't hesitate to drop, to just say it out loud right now. Turn on your mic if you're interested in being a little conversational with us. That's the beauty of yoga, is that we come together, we support each other, that just sharing our lived experiences with each other can help us gain more understanding and gain more just calmness throughout it, because we're supporting each other. We're all on this journey together, whether you have a mild curve, a large curve, or none at all, right? We're working with just calm body and mind, body, soul practices, right? The next slide is just references in the research article that that is published on Om Hom Shala's website. There's a little bit more information, or like it's a bit more extensive than what's covered in this presentation. So I just, again, want to thank you all for being here, for everybody who shared a question, everybody who shared an insight, a recommendation. I'm so grateful for your contribution to co-creating this presentation on scoliosis. Thank you.
Thank you, Julia.
Thank you, Christine. Thank you for your time, everybody. Thank you for your energy. And I'm super excited to see what the future of yoga therapy for scoliosis looks like, right? there is always more research being done. And there's so much more in the field of yoga therapy for scoliosis that I didn't cover in this presentation today. So if it's something you're interested in, we can keep the conversation open, like email me. If you have my number, text me, and we can keep this conversation open. Thank you. So I have about 10 more minutes, and that's just where we want to focus on getting into. So I'm going to stop sharing my screen right now so we can jump into focusing on writing a testimonial. It is very helpful for